If you're eating too much protein on a low carb, keto, ketovore, carnivore diet, you will spike your blood sugar. Wait, where'd you get that from? Duh, gluconeogenesis. In this video, we're gonna break apart gluconeogenesis when you're eating either a moderate protein diet or a high protein diet and destroy, hopefully, the very persistent myth that eating a high protein diet is going to spike your blood sugar because of gluconeogenesis. I'm Dr. Ken Berry, a family physician with 20 years of clinical practice, and this video is about gluconeogenesis, and you're going to learn that it's your friend, not your enemy. Gluconeogenesis is a natural, normal, ubiquitous, and very safe process that happens in your body. In fact, it happens in everybody, every mammal, every reptile, every bacteria, even fungus. Gluconeogenesis happens across all kingdoms. It is one of the most evolutionarily conserved processes that we know about. So don't think that it's some new and terrible thing that pops up its ugly head when you're eating a low carb, ketogenic carnivore diet. That's just not true. Your body can use many different substrates to make glucose. And there are a list of glucogenic amino acids, which come from the breakdown of protein. But I'm not even going to tell you what this list is, because I know then you would Google this list and you would try to find a diet that avoided these glucogenic amino acids. But what you have to understand about gluconeogenesis is, first of all, let's repeat after me. It's normal, it's natural, it's ubiquitous, and it's safe. It's okay. Gluconeogenesis is your friend. It's not your enemy. Gluconeogenesis is a demand-driven process. It is not a supply-driven process. And so there are low carb keto gurus out there who still are parroting the myth that if you eat too much protein, you will force your liver into producing glucose and spike your blood sugar and kick you out of ketosis. And this is just not the case. The only cells in the human body that we know for sure need glucose, they cannot burn ketones or fatty acids for fuel, are erythrocytes, which are your red blood cells. They don't have nucleus and they don't have mitochondria. They cannot make their own energy. They have to run on glucose. Now, you'll hear people say that there are other cells in other places, most commonly in the brain, but that's also probably not true, and I'll tell you why in a second. The fact of the matter is that your liver can make all of the glucose that your body needs. You don't have to ingest any glucose. No carbohydrates are necessary. Your body has got this. Your liver, which is one of the smartest organs in your body, perhaps even smarter than your brain, it knows exactly how much glucose you need from minute to minute and is happy to produce it very quickly and very safely when your red blood cells need that. Humans can also initiate gluconeogenesis in their intestines, part of your intestines, in your renal cortex, that's the outer part of your kidney. And then also we now know that astrocytes in your brain, this is a particular kind of cell inside the human brain, astrocytes can make glucose as well. So if some of your cells in your brain need glucose, you don't have to eat 120 grams of glucose a day to fuel your brain. Again, another myth that needs to die. Your astrocytes inside your central nervous system are happy to make glucose whenever your brain and your nerves need it. Research shows that if you're still eating too many carbohydrates for your personal physiology, and for some people this could be more than 100 total grams a day, for some people 50, for some people 20, and so you're eating too many carbs still, and you add protein, actually you add amino acids to this mix, which come from eating protein, then that definitely can elevate your insulin. It can definitely make your blood sugar go up temporarily. But as you eat a low carbohydrate diet, and so you're eating the amount of carbohydrates that is right for your personal biochemistry and physiology, that may be under 100, that may be under 5 total grams of carbohydrates a day, then you cannot make your liver or your kidney or your intestines or your astrocytes make glucose if your body doesn't need it. It just doesn't work that way. So the next time you hear a guru out there say, oh, if you eat too much protein, you'll initiate gluconeogenesis and spike your blood sugar, you can safely hit the unfollow button, because if they're deficient in knowledge about that subject, what else do they not know about either? If one of your friends says this, then you can lovingly, respectfully, gently say, actually, that's not the case. Now, if you don't believe me, or if your friend doesn't believe you, I'm going to put quite a bit of research in the show notes down below to help you understand this. Also, I'm going to link to an excellent video by Dr. Ben Bikman, Professor Ben Bikman, who really understands this stuff well. He's made the study of insulin and glucose and glucagon his life's mission. And so if you're still unsure after you watch this video, watch Dr. Bikman, Professor Bikman's video down in the show notes below, and he'll bring it home. He doesn't even slide. He just walks across home plate. The entire key to enjoying all the benefits of a ketogenic diet, and you can get these from eating very, very low carb, from eating keto, from eating carnivore. Any of these will give you all these benefits. The key concept you have to understand is that it has to be a very, very low carbohydrate diet. And the amount of carbohydrates really depends on your personal biochemistry and physiology, your age, your current health status, perhaps your gut microbiome, perhaps your genetics. All of these things play a part in that. And so it's common when somebody's converting from eating the standard American diet, standard Western diet, full of carbohydrates, highly processed, when they add protein to that diet, which breaks down into amino acids, they'll see a noticeable blood sugar spike on their glucometer. But as they convert to a ketogenic diet, super, super low carb, carnivore, they stop noticing this. And that's because it no longer works that way. Once they have healed their metabolism, gotten their insulin level down to where it needs to be, got their glucagon level where it needs to be after a few weeks or a few months of eating a ketogenic diet. If you have a friend or a loved one who still believes that too much protein will spike your blood sugar, or if you know a keto guru out there who's still saying that, please consider sharing this video with them. It'll help them understand human physiology a little better, understand why the specific choices they make in their nutrition on a day-to-day basis matters very, very much. Always remember that your liver is going to make just as much glucose as your red blood cells need. It's doing this right now. Even if you haven't eaten a carbohydrate all day long, or if you've eaten a ton of carbohydrates, your liver is going to closely monitor your blood sugar levels. And if you need some glucose for your red blood cells, it's going to make that. If your brain, if the neurons and other cells in your brain need glucose, your astrocytes have got this. They don't need you to eat carbohydrates. Your astrocytes will make glucose minute to minute as needed by your brain. And I also included some research links down below about the astrocytes and their role in making glucose for your brain if it needs it. So stop worrying about having to eat carbohydrates for your body to have enough glucose. And then definitely stop worrying that eating too much protein is going to just make gluconeogenesis spiral out of control and cause your blood sugar to spike and all the damage that comes with that. It doesn't work that way. It's not going to happen. I promise you, keep your carbohydrate intake very, very low. Your red blood cells, your body, and your brain will be just fine. Keep your protein level very, very adequate. Most people in the world are not eating enough protein, and this probably includes you. Do not be afraid to eat protein because of gluconeogenesis. Now, if you're afraid to eat protein for another reason, I've got videos about that on this YouTube channel as well. You can check those out. If you'd like to join me in my mission to fight the epidemics of obesity, type 2 diabetes, prediabetes, fatty liver, chronic fatigue, and all the other chronic diseases that come from eating an inappropriate human diet, and help people understand that there is in fact a proper human diet, please become a patron. I've got a link down below. It's a super quick sign up, and then you can throw a buck or two my way to help me fight, to fight alongside me, to help the entire world understand that you don't need to eat that many carbohydrates and that you never need to fear eating protein. This is Dr. Berry. I'll see you next time.